Have you ever gone to the doctor's office, sitting in the waiting room, extremely nervous, just thinking to yourself, what are they going to tell me? Are they going to say it's a simple fix that, lay your fears to rest? Or are they going to give you bad news? Well, 5 years ago, that was me. I'd been seeing my doctor for about 15 years for a variety of different reasons, and on this day, she came in, sat down, put her hand on my leg, said, "Jennifer, you have PCOS." My mind went completely blank. I had never heard of this condition. And her only reassurance was, "Here are a few pamphlets for you to read." I had to know more about the condition. So, I needed to know what is PCOS? What causes it? What are the symptoms? Is there a cure? Am I going to be on medication for the rest of my life? I went home for a solid week. I looked in books, I researched internet, everywhere that PCOS was even mentioned. I come to find out that between 1 in 10 of all women in their childbearing years have PCOS. That's about 5 million women just in the U.S. alone. After further research, I discovered that PCOS actually stands for polycystic ovary syndrome. Basically, it's the formation of a cyst on the ovary. These cysts actually deplete the required hormones from the eggs that are growing inside the ovary. And of course, without the required hormones, the egg won't fully mature and therefore not travel into the fallopian tube and causing women not to menstruate. Currently, the causes of PCOS are unknown, but most experts think genetics may be a big role. Most commonly, like another family member, mother or sister may also have the condition in your family. PCOS starts showing symptoms at puberty, generally when a young girl gets her first menstrual cycle. Diagnosing and treating this condition early is extremely important because it can reduce the degree of your symptoms. There are 12 PCOS symptoms. Infertility, absent or irregular menstrual cycles, increased hair growth on your face, chest, stomach, and back, acne, oily skin, cyst on the ovaries, of course, weight gain, obesity, male pattern baldness or thin hair, patches of skin on the neck, arms, breasts, and thighs, skin tags, pelvic pain, anxiety or depression, and the worst, sleep apnea. Recently, I met with a new doctor, and he informed me that women with PCOS have greater chances of developing serious health conditions. 50% of all women with PCOS have diabetes before the age of 40. The risk of heart attack is 4 to 7 times higher, having high blood pressure, high cholesterol, and even endometrial cancer. According to the U.S. Department of Human Health and Services, PCOS is not curable, but it does need to be managed to avoid serious symptoms and problems. The best first step for anyone is constant communication with your physician. A few management options, like birth control, diabetes, fertility medications, medications to increase like hair growth, and for the extreme, you can do ovary surgery or like a weight loss surgery. For the past 29 years, I've been dealing with this condition. And because I was diagnosed so late, I haven't had any success with any of the medications I've been given. PCOS affects so many women, and it can be life-threatening. I believe that spreading the word is vital to early diagnosis and education awareness. Now that I've told you a little bit about what PCOS is, what the symptoms are, the fact that there is no cure, but that there are medications out there to help, I implore you, spread the word. Think about all the women in your life that are over 15 and under 40. If you know someone who shows at least 9 of the 12 symptoms, please encourage them to see a doctor or at least get tested. You could be saving someone from years of pain or even death. Thank you very much and for listening, and y'all have a great day.